So if we talk about relapse in addiction or substance use disorder, first I think it's very important to point out that relapses are part of the course of the disorder. So a relapse is not a really disappointment for the patient and should not be a disappointment neither for relatives nor for health professionals who are involved in that. And it's very important to inform from the beginning the patient that we have to deal with relapses, we have to deal with the intensity and the frequency of relapses. And basically, if we do a professional treatment, by the time the intensity is reducing and the frequency as well. However, we need to be a lot of patient, and I think it's very important for relatives, because usually relatives are very much involved in the process, to inform them this is not a failure of a patient, this is the course of the disorder. And I very often try to inform all involved people that we look into diabetes or asthma or depression. It's a chronic disorder, and relapses are part of this disorder, with actually a focus we should not lose, that we are reducing relapses. What is important to improve the treatment and to decrease the likelihood of relapses? From my point of view, the most important aspect is diagnosing and treating the comorbidities. Very often, and unfortunately, unlike to any other psychiatric disease where we have consensus statements, substance use disorder is very much related to national laws, and almost each country has a different approach. So standardizing and giving a general rule how to do it is very difficult. As in many countries, substance use disorder patients, to a vast majority, are treated through general practitioners. In other countries, only in specialized clinics. In other countries, specialized doctors. So there's a huge heterogeneity. And the best outcome, based on my professional life, is having a multidisciplinary team and focus not only on the individual substance which is abused or misused by a patient, but looking into the whole individuum and try to make a proper diagnosis. Is there an underlying depression? Is there an underlying anxiety disorder? Or is there an underlying attentional deficit disorder? And if we neglect this comorbidity, who are very often the reason why substance use disorder is developed, then we will not be able to stabilize a patient.